The Johnson & Johnson COVID vaccine will remain in limbo a while longer. After a 4-hour meeting today, U.S. health advisors told the government they need more evidence to decide if a handful of unusual blood clots were linked to the shot. State health officials say they will not use the J&J vaccine until a decision is made. Jen Boniza follows up.
The Department of Health says they will hold on to the doses of Johnson & Johnson that they have in stock until more information is available. And officials are urging people to continue to get their shots, reminding them that both Pfizer and Moderna are still safe. In a statement, the Department of Health says they appreciate the cautious approach the Advisory Committee on Immunization Practices is taking. While severe adverse reactions to the Johnson & Johnson vaccine are extremely rare, safety is always our top priority. We will wait until the committee issues further recommendations. Senator Jarrett Keohakalole is one of more than 17,000 Hawaii residents who received the single-dose vaccine.
This is unfortunate. I think it's important that we follow the guidelines of the federal government and the medical community. So if they say we need to pause, then we need to pause.
He says he's not worried about having an adverse reaction.
Got it before, and I'd get it again if the doctors say that it's safe to use.
He hopes what's happening encourages people to get vaccinated.
7 million people have taken this shot, and 6 people have had an adverse reaction. And we're pausing utilization of the vaccine. So I think that in and of itself should show folks that there are very rigorous scientific and medical criteria that these vaccine manufacturers need to go through.
The lieutenant governor says thousands of Johnson & Johnson vaccine appointments were canceled.
My wife was one of them who was going to get, Jamie was going to get the Johnson & Johnson shot on the 20th, and instead will be switched to the Moderna or Pfizer shot. So lots of families just like ours are in this boat.
According to Green, losing one COVID vaccine option shouldn't impact the state too much.
I would say it will probably take us an additional 2 weeks to get to herd immunity in our state because of the small number of the Johnson & Johnson shots that were planned to be part of our mission.
He says they can store the Johnson & Johnson vaccine for up to 3 months. DOH still plans to open vaccinations up to everyone on Monday, April 19th as planned, offering the Pfizer and Moderna vaccines. CDC advisors are holding their next meeting on May 5th. No word if they will meet sooner or if they will be discussing the Johnson & Johnson vaccine at that time. Jen Boniza, KHON2 News, working for Hawaii.